Hello friends, in today's class we'll discuss regarding genetic counseling in eye disorders. We'll discuss the aims of genetic counseling, the purpose, indications, types of counseling available, the areas in which the genetic counseling is provided, the steps of providing the counseling, and the management strategies of these patients. Okay, we have eye disorders like retinitis pigmentosa, Leber hereditary optic neuropathy, and retinitis pigmentosa. So in these cases, retinoblastoma, we need to provide counseling to the patient as well as to prevent the disorder from occurrence, right? So that's why this is very important. So we will discuss what is genetic counseling. So the definition: it is a communicative process which deals with human problems associated with the occurrence of a genetic disorder in a family. So it's a process, communication, in which it deals with the problems associated with the occurrence of genetic disorder in a family. So what are the aims of this? So it attempts to understand medical facts. So patient don't know regarding the disorder, why it is occurrence, what is the diagnosis, what is the course of the disorder. Okay, so the available management strategies and all. So we need to make them understand the medical facts. So we have to make them understand the mode of inheritance and the risk of developing or transmitting the disorder. Okay, so in case of autosomal recessive condition, the patient may not have anything regarding the disease, but they will fail to understand that they can transmit it to the offspring, right? So we need to make them understand the mode of inheritance and thus the risk of developing or transmitting the disease. So we have to make them understand the alternatives to deal with the risks which are associated. So what is the cause of the disease and what will it at the end lead to? So it will lead to a cancer or loss of vision or what. So we need to make them understand the alternatives and how can we deal with the risk. So we have to at the end provide them a little bit of information regarding the management, right? So that is more important. Then it aims to choose the course of action, so they can choose what is appropriate for them. Okay, so in this way we'll make them understand that rather than having a blind child and suffering for the parents throughout the year, they can understand and they will choose the action appropriately. Coming to the purpose, so this topic is more regarding the SPM part and all, so it is little bit boring, but yes, we need to remember this because it is asked in recent advances paper 4. Okay, so coming to the purpose, so it provides accurate information about the disorder So it allows the individuals to make informed decisions and it educates them about the inherited disorders. It helps to reassure people and it offers skilled support, right? Now coming to the indications of genetic counseling. So it is indicated in advanced parental age. So the maternal age more than 35 years and the paternal age more than 50 years. So in case in which the previous child or there is family history of the disorder like congenital anomaly, intellectual disability, birth defects, metabolic or chromosomal disorders. So we can also have this adult onset genetic disorders such as cancers in case of consanguineous marriages, in case of exposure to teratogen in pregnancy, in case of repeated pregnancy loss or infertility issues, or if there has been a screening abnormality in the pregnancy. So such as the alpha fetoprotein, the triple test, the quadruple test, ultrasonography, karyotyping, these are all affected. Okay. Coming to the types of genetic counseling. It is prospective or retrospective. So prospective, it actually allows for the true prevention of disease. So it requires identifying the heterozygotes or the carriers of the disease. So we can identify it by the risk of disease on marrying another heterozygote. So in risk of marrying a heterozygote or a carrier, and we have to reduce such marriages. Okay, so examples in case of sickle cell anemias, thalassemias, like that. Then we have this retrospective. This is most commonly given now because the disorder has already occurred in the family. So yes, Coming to the areas, what are the areas in which we can provide genetic counseling? So it is prenatal, pediatric, or adults. So prenatal is, as we discussed earlier, on the prenatal diagnosis, treatment, or the screenings, all these which have caused this. Okay, so that is prenatal. And the pediatric, that is in cases of a syndromic baby. And in adults for carcinomas. So this is prenatal diagnostics. So coming to the steps of genetic counseling, we have to perform history taking and physical examination. Then we have to do pedigree charting. Which involves at least 3 generations. Okay, so followed by the risk assessment. That is mode of inheritance. Then we have to go for diagnosis. So the diagnosis is with the help of, for in case of prenatal, you can perform imaging, like ultrasonography, fetoscopy, MRI. So these all can be useful in case of retinoblastomas. And with fluids, that is amniocentesis and chordocentesis. And fetal chorionic villus sampling, maternal serum, alpha fetoprotein, triple test and quadruple test, and maternal cervix for fetal fibronectin. Okay, so these are the diagnostic modalities for prenatal testing. For postnatal testing, we'd have to perform the test which is specific to that disease. Okay, so that is postnatal. Then after the diagnosis, we have to give communication regarding the disease. And we have to give the management options. And we have to attach them with support groups, because the mental support is always important in these cases. Okay, so what are the management options available? So when the disease has already occurred, like in case of the retrospective genetic counseling, we have management options like contraception, pregnancy termination, or sterilization. Okay, So these are the actual options which are available in these cases, right? So this was regarding genetic counseling. We will discuss genetics of retinoblastoma and the treatment in the next class. Thank you.